do SB 41,
Okay.
which is file item 53.
Floor is yours.
But
The floor is yours.
thank you, Mr. Chair. Colleagues, I'm here today to present SB 71, which will require transparency, licensing of pharmacy benefit managers, PBMs, and will also ban certain anti-competitive practices that are driving community pharmacies out of business and increasing the price of prescription drugs. PBMs play a huge role in our healthcare system. They started out decades ago as small administrative bodies that helped health plans negotiate or put together drug formularies and negotiate drug prices. They have since grown into mega corporate behemoths that operate at the center of our healthcare system among prescribers and health plans and pharmaceutical companies, and they play a huge role in determining what prescription drugs people can have access to and what the prices are. And they negotiate those prices, and they have an incentive to favor higher priced drugs because they make more money that way because of rebates. They also tend to own their own pharmacies, their own mail-order pharmacies, and they steer people towards those pharmacies away from brick-and-mortar pharmacies. And while some people prefer online pharmacies, many don't, and they are therefore not going to see their community pharmacist, and that pharmacy is a healthcare provider. There have been various exposés on the abusive practices of PBMs around spread pricing and their rebate programs and the steering away from brick-and-mortar pharmacies. And this bill will put an end to those abusive practices. It'll require that they be licensed so that they can be overseen. This is a reform whose time has come. I want to say we have got, on this bill, including the last version and then this version, we've received broad bipartisan support. There's bipartisan support in Congress to take action. The time has come, and I respectfully ask for your aye vote. With me to testify is Parth Parikh, who's a pharmacist and owner of PicoCare in Pico Rivera, California, and Colleen Henderson, a patient advocate.
Thank you very much. First witness, please.
Hi, my name is Dr. Parth Parikh, owner of PicoCare Pharmacy in Pico Rivera and PriceCare Pharmacy in Downey. I serve a community that face significant socioeconomic challenges and need accessible, compassionate, and personalized healthcare. Unfortunately, current insurance and PBM systems is moving in the opposite direction, reducing access and prioritizing profit over patient care. PBM steers patients towards mail-order pharmacies, which often involve long hold times and impersonal service. For patients living paycheck to paycheck, this added complexity becomes a major barrier to their care. Patients who choose a local pharmacy like mine are often penalized with a significant higher out-of-pocket cost, non-preferred pharmacy, sometimes hundreds of dollars more, simply because we're not PBM owned. Roughly 80% of my patients face these financial burdens despite receiving a faster face-to-face care with no more than 2 minutes wait time at my pharmacy. We offer a free home delivery service with drivers who act like community health workers, provide personalized service like pillbox packaging, in-home vaccinations, and compounded medications. Because PBM often reimburse us below our cost, independent pharmacies are forced to turn patients away or close entirely. Recently, I had to send a patient to a nearby PBM-owned pharmacy due to unsustainable reimbursement rates. Her experience was so poor that she offered to pay more out of her pocket just to return back to me. She ultimately switched her insurance, which allowed her to come back, even though she is 25 miles away from us. She was lucky that she had an option, but most people don't. I think it's important to note that she was a state employee, just like yourself.
Thank you very much. If you could wrap it up.
All right. So just want to let you know, a lot of my colleagues are thinking of closing down pharmacies because of this. So I'm really requesting and support for this bill so that we can stay in business.
Thank you very much. Next witness, please.
Thank you, Chair and members. My name is Colleen Henderson. I live in Auburn, California. I'm here to explain how large PBMs play a major role in keeping medication costs high and creating unnecessary barriers to care. My daughter, she lives with hidradenitis suppurativa. It's called HS. It's a chronic inflammatory condition that attacks your hair follicles and causes your skin to bubble like third-degree burns, and it never gets better. There's no cure. To prevent progression, not flare-ups, not prevention of the disease, my daughter injects herself 2 times a month with Humira, a biological medication. It's critical she takes it on time, otherwise her progression will never regress. It'll always continue to move forward. Unfortunately, the PBM associated with my health plan barely covers Humira, so we have to jump through constant hoops and pay out of pocket nearly $7,000 out of pocket per month is my portion. And the difference, what the PBM charges and what my insurance covers, is insane. My insurance covers $947 of that. Large PBMs like CVS Caremark, Express Scripts, and Optum Rx determine which medications are covered. They steer patients to their own affiliated pharmacies and manipulate pricing. It drives costs up for patients and independent pharmacies. As most don't realize, these large PBMs are closely affiliated and the majority of the time owned by health insurance companies. Express Scripts is owned by Cigna. Optum Rx is owned by a subsidiary of United Healthcare. CVS Caremark, which is what I have to use, is associated with Aetna and Blue Shield Blue Cross. In order to increase profits throughout the companies, there are confusing rules and burdensome processes that families like my own are forced to navigate and pay high costs for just to access the medications we need and can't go without. SB 41 will help protect patients from these abusive PBM tactics.
Thank you. I assume you're urging an aye vote.
Yes.
Yeah, thank you very much. And I know you've been here all day, and I apologize to witnesses that have been here all day. Unfortunately, I'm going to have to adhere to the 2-minute time limits. So thank you. All right, next witness, please.
Kim Stone, Stone Advocacy on behalf of the California Orthopedic Association in support, and I was also asked to register a report of the American College of Obstetrics and Gynecologists.
Thank you.
Laramie Hunter with the Liver Coalition of San Diego in strong support.
Thank you.
Fred Notware, representing the Pharmaceutical Research and Manufacturers of America in support. Thank you.
Thank you.
Chair and members, Moira Top on behalf of Biocom California in support.
Thank you.
Jennifer Snyder, representing the California Life Sciences and the National Association of Chain Drugstores in support.
Thank you.
Tim Madden, representing the California Rheumatology Alliance in support.
Thank you.
Louise Mailer on behalf of Indivisible California State Strong in strong support. Thank you.
Thank you.
Kevin Guzman with the California Medical Association in support.
Thank you.
Good evening, Michelle Johnston with the National Multiple Sclerosis Society in support.
Thank you.
Mr. Chair and members, Rand Martin on behalf of the AIDS Healthcare Foundation in strong support of this outstanding bill. Thank you.
Chair and members, Kathy Mossberg with the San Francisco AIDS Foundation, a co-sponsor in support, as well as APLA Health.
Megan Subers on behalf of the Los Angeles LGBT Center, co-sponsor in support. Thanks.
Lori Martinez on behalf of the California Board of Pharmacy in support.
Thank you.
Michelle Rebus with the California Pharmacists Association, co-sponsor in support.
Thank you.
Liz Helms, California Chronic Care Coalition, co-sponsor in strong support.
Thank you.
Alan Sergestian, intern pharmacist from University of the Pacific in support.
Caitlin Acato, intern pharmacist at University of the Pacific in support.
Thank you.
Alex Kahn on behalf of the ALS Association in strong support.
Thank you. Others in support? Seeing no one else approach the microphone, if you're opposed to SB 41, please approach the microphone.
Thank you, Mr. Chair. Members, John Winger here on behalf of America's Health Insurance Plans and the National Trade Association for Health Plans. First, I want to apologize for our letter not getting in. Apparently, I still am figuring out the portal on double referrals, but we do have opposition to SB 41 for a variety of reasons, but in the interest of time and given this committee's jurisdiction, just wanted to focus on one specific issue related to the bill, which is related to ERISA preemption. AHIP believes SB 41 violates federal law that protects employees' benefit plans. Federal ERISA preemption is intended to provide employers and employees consistency and uniformity of plan administration. SB 41's departure from ERISA preemption risks adding needless costs and disruptions of coverage for roughly 18 million of California workers, retirees, and dependents who rely on ERISA-related coverage. A 2020 ERISA provision case was upheld unanimously by the Supreme Court that affirmed state laws are preempted by ERISA when they impact a core function of health plan administration or directly relate to the health plans. The case clarified a narrow set of activities that states could regulate. However, we believe SB 41 goes well beyond this and is therefore preempted. Since only collectively bargained Taft-Hartley self-insured plans are excluded from SB 41, we believe this bill runs afoul of federal preemption law. For those reasons and for others, we are opposed to the bill.
Thank you. Others in opposition, please approach the microphone. If you're in opposition to SB 41, please queue up.
Kelly LaRue with Resilient Advocacy on behalf of the California Chamber of Commerce with an opposed and less amended position. Thank you.
Thank you very much.
Nick Luizos on behalf of the California Association of Health Plans in opposition.
Thank you.
Allison Ramey on behalf of the Pharmaceutical Care Management Association. We remain opposed.
All right, thank you very much. If you're opposed to SB 41, please approach. Seeing no one else opposed, let's bring it back to committee for questions. Questions by committee members. Yes. Dr. Weber-Pearson.
Want to once again thank the author so much for bringing forward this bill and really working at it. I know this is the second time around at this very important issue. Was wondering, I know it's late, so I apologize, but if you can elaborate a little bit more on how you feel this would go against ERISA.
Yeah, so self-insured plans. I actually have an entire flow chart if you want. It makes it a lot easier. But there was a 2020 case where there were some minor things that Supreme Court basically said that you could regulate at the state level, but there was a lot of core functions of the health plan administration that they said is preempted by ERISA. A lot of that is included in this bill related to benefit design, contracting with certain pharmacies, reporting information, adjudication, and then some minimum reimbursement stuff. All of that is still within the core function of the plan, and so we believe is preempted by ERISA. And so we've, in the past, last year and this year, have asked that ERISA not be in the bill, or ERISA plans not be in the bill.
Okay, if you could, I'd love to see that. If you could drop that off at my office in the morning, that'd be great. Want to thank those who came and testified and for staying this late. Really appreciate what you do for your community. You are really how we envision independent pharmacists really working with the community and more than just dispensing medication, and really appreciate you sharing your story. I've diagnosed many patients with hidradenitis, and I know how very, very difficult, challenging, and expensive it can be to just prevent those flares. So thank you so much for staying and sharing your story with us. And with that, I'd like to move the bill at the appropriate time.
All righty, thank you very much. Other questions? Seeing no other questions, Senator Weber-Pearson has moved the bill. Senator Wiener, would you like to close?